Daily feeding tip. You're working with a child and you realize that their primary pediatrician has marked NPO on the referral or in their chart. Does this mean that you can't work with foods or liquids in your feeding sessions or in your evaluation? No. Interestingly enough, I think most doctors who record NPO are really thinking about oral nutrition. So they're thinking about this child eating a large volume of food, enough to sustain them with their nourishment and their growth. In feeding therapy, of course, ultimately, we would love to see our kids eat everything by mouth safely and efficiently, so that's their main method of intake. However, sometimes when kids are very medically complex or they're having orofacial surgeries, etc., that's a work in progress. So I would say you have to start where you are. If you get a referral that says NPO or a doctor sends over a note that says NPO, reach out to that pediatrician and kind of talk through how you can use tastes of food within your feeding therapy sessions and ask if there's any flexibility within OT feeding sessions to work with very small amounts of food. For example, this might look like, "Hey, Dr. Johnson, I understand that you don't want this child eating by mouth. Can I explain to you how we were using purees to promote tongue skills so that they can get stronger so that they're ready to eat by mouth? All I really need is approval to work with up to a tablespoon a day. Do you feel like that this might be safe for this child?" Most pediatricians, once they have the opportunity to collaborate with you, will help you come up with a plan that makes sense and update NPO status accordingly so that you're not absolutely chained down in feeding therapy sessions. Thanks for watching. If you enjoyed today's daily feeding tip, be sure to click subscribe below to join the Peds Feeding Tribe YouTube channel to get more content just like this and hear all my daily feeding tips.